Hello, my name is Dr. Dewan S. Raja. I am the author of Toxicology Digest book. Today I'll discuss about carbon monoxide poisoning. This is a colorless, odorless, tasteless, and non-irritating gas. So this is a silent killer. It is formed by incomplete combustion of carbon-containing material. So if it is complete combustion, then we'll get carbon dioxide, which is less toxic. But carbon monoxide is formed by incomplete combustion of carbon-containing material. Common sources are inhalation of fire, especially people entrapped in a burning quarter or burning building, automobile exhaust, poorly or faulty ventilated furnace, lantern, stove, cigarette smoke, and burning biomass. Accounts for about 40,000 emergency room visits each year in the United States of America. Around 900 deaths. Around 200 people attempt to commit suicide by inhaling carbon monoxide. Accounts for about 50% of air pollution. So what is the mechanism of toxicity? Carbon monoxide displaces oxygen from the hemoglobin. This is the RBC, red blood cell, containing hemoglobin. Hemoglobin carries oxygen and carbon dioxide. This is normal. But carbon monoxide binds very tightly to hemoglobin, displaces the oxygen, and carbon dioxide is displaced. Carbon monoxide occupies the spaces of those, and it has about 250 times higher affinity than that of the oxygen, higher affinity for hemoglobin than that for oxygen. Carboxyhemoglobin is produced and it interferes with the release of oxygen to the tissues. So the hemoglobin is the carrier for oxygen, and if we have carboxyhemoglobin, then there will be shifting of the oxygen hemoglobin curve, and there will be decreased release of oxygen to the tissues. Carbon monoxide inhibits cytochrome oxidase. This is present in the mitochondria of the cell, so interrupts cellular function. There will be no cellular metabolism. There will be no cellular respiration, ATP production, due to inhibition of cytochrome oxidase of the mitochondria. Carbon monoxide binds to myoglobin and weaken cardiac and skeletal muscle because myoglobin carries oxygen for the cardiac muscle, skeletal muscle. So people will have disturbed cardiac function and skeletal muscle function. What is the pharmacokinetic of the carboxyhemoglobin? Carboxyhemoglobin dissolves gradually, it dissociates gradually. Its elimination half-life is 200 minutes at room temperature, 74 minutes with high flow oxygen with endotracheal tube, and 12 to 30 minutes with hyperbaric oxygen therapy. Toxic dose. What is the toxic dose of carboxyhemoglobin and carbon monoxide? Recommended carbon monoxide level limit is 15 ppm, parts per million. Ideally, it should be 9 ppm in a 8-hour a day job. It is considered dangerous to life in 1200 parts per million. Blood carboxyhemoglobin greater than 25% is considered alarming. Blood carbon monoxide greater than 40 to 50% shows obvious toxicity. Okay, it is a typo, Greater. Okay. Symptoms of carbon monoxide poisoning. It depends on extent and duration of carbon monoxide exposure. Symptoms of intoxication mostly affects the brain and heart, because brain and heart needs oxygen too much in comparison to other tissues. Patient complains headache, nausea, dizziness and blurred vision, loss of memory, cognitive dysfunction, and may develop convulsion. But a lot of patients may not show convulsion and other gross dysfunction. They have just headache, nausea, vomiting, like flu. So they suspect it is a flu. A lot of people in the same complex may have the same symptom of flu. When they are staying outside their home, they come back after a few days of break, they become symptomless. Patient may experience angina, myocardial infarction, arrhythmia, hypotension and congestive heart failure. Cherry red color on the dependent part of the body. Venous blood will look bright red. These two are very good sign of carbon monoxide poisoning. Cherry red color, the dependent part of the body, and venous blood looking bright red, but they may not be present in all cases. Okay, but they are very much obvious sign of carbon monoxide poisoning. Diagnosis. History is very important to us. History of carbon monoxide exposure, such as patient found in a car in a locked garage, and the patient in the winter time, they may put in some type of natural disaster, they put their generator inside the closed quarter or in the garage, or they make barbecue in a very closed space. Suspicion based on warning sign of carbon monoxide poisoning. Warning sign like that of the nausea, vomiting, headache, convulsion, lack of vision, and there may be gross fatigue. Cherry red skin color and bright red venous blood. Assessment of carboxyhemoglobin level in the blood. ECG, because there may be cardiac arrhythmia due to ischemic condition in the heart. Serum electrolyte, there may be metabolic acidosis. This is present in toxicity of carbon monoxide. Blood cyanide and methemoglobin concentration is essential, because especially person who is exposed to this cyanide and methemoglobin, especially in a burning room, that may be present. But we have to remember that partial pressure of oxygen and pulse oximetry are misleading to diagnose carbon monoxide. Rather, we'll give more emphasis on carboxyhemoglobin, blood level of carboxyhemoglobin. That may also be misguiding in a newborn or the young age because of fetal hemoglobin. Okay, treatment of carbon monoxide poisoning. First of all, decontamination. If a person is in a burning room, that person should be rescued from that room as early as possible to the open air. A, B, C. Airway should be open. Breathing should be continued. Circulation should be okay. There should be pulse. There should be breathing. So if his person is in a burning room, his or her mouth should not be blocked by ashes. Antidote for carbon monoxide poisoning is 100% oxygen. Oxygen may be used by tight-fitting mask with a non-rebreather reservoir, or administering oxygen through endotracheal tube. So passing the tube to the trachea, okay, that will confirm more delivery of oxygen under high pressure. Okay, these are the antidotes. But we may have another option, hyperbaric oxygen in a patient with severe condition. We have indication for hyperbaric oxygen. This is the oxygen, high flow oxygen passed to a person's body under 2 to 3 atmospheric pressure. indication for hyperbaric oxygen, loss of consciousness. Suppose a person is entrapped in a coal mine for a long time. In pregnancy, problem is that mom may not have severe sign symptoms, but the fetus has severe toxicity. Fetus is more vulnerable to carbon monoxide poisoning. Evidence of end organ damage like that of the brain or heart or kidney damage, metabolic acidosis, carboxyhemoglobin level greater than 25%, and cerebellar dysfunction like that of ataxia. How can we prevent carbon monoxide poisoning? First of all, awareness, health education, and we should always alert during the winter month. A lot of accident happen during winter month. During the time of disaster, people used to run their generator in the garage. Never run car, motorbike, generator, lawnmower in a closed garage. Fit carbon monoxide alarm near the bedroom. If the bedroom is upstairs, downstairs, then we can use multiple carbon monoxide alarms. And we must check the battery of the carbon monoxide alarm. Inspection of gas appliances, heating system, chimney and flues every year. Emission control on vehicle is very important. A lot of city adopt that policy, and in the city dweller, the car or vehicle is the most common cause of carbon monoxide in the atmosphere. And person entrapped in a big traffic jam, the driver may be exposed to carbon monoxide. If he is a smoker or she is a smoker, then more chance to get carbon monoxide poisoning. When the alarm rang, please get out of the house, call 911, and take all the occupant at the house should be out of that house. We can call Regional Poison Control Center. This is an important number, 800-222-1222, for advice and location of hyperbaric chamber, because hyperbaric chamber is not present everywhere. Okay, and we must know that the hyperbaric chamber is essential in case of severe toxicity. So what are the indications of hyperbaric oxygen? Loss of consciousness, pregnancy, evidence of end organ damage, metabolic acidosis, carboxyhemoglobin level greater than 25%, and cerebellar dysfunction. These are the conditions we need hyperbaric oxygen. But this also works, but it takes little more time than that of hyperbaric oxygen. And the hyperbaric chamber is not placed in all the cities. Okay, so this number can help to locate the hyperbaric chamber and also give advice what to do. And that's all about the carbon monoxide poisoning. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. And I have a book called Toxicology Digest that is available in Amazon. It is both in paper copy and electronic copy. You may call Amazon or get the copy from Amazon if you like. These are other resources. We can read that if you have time. And everyone should have a good day. Thank you very much. Bye now.